Welcome to this instructional video on intramedullary nailing of a femur fracture. This procedure will stabilize a broken femur using a metal rod, screws, and a bolt to help the bone heal in proper alignment. Today, we'll walk through the key steps performed by our surgical team. Using the C-arm, we first identify key landmarks and plan our incisions. This helps visualize the fracture site and entry point for the femoral nail. A guide pin is advanced into the top portion of the femur. We confirm the alignment of this guide pin in the center of the femur using multiple C-arm views. Once the guide pin is placed, we use a cannulated drill inserted directly over the pin to create a large opening at the top of the femur. Now that the large opening has been created in the femur, a longer guide wire is inserted through this opening, passing through the entire canal of the femur until it's reached the end portion of the bone near the knee. The C-arm confirms proper placement of this guide wire in the femoral canal. With this guide wire in place, we use the C-arm and a calibrated ruler to measure the length of the femur. With this measurement, we can select the appropriate length for the actual femoral nail implant. Earlier, we had created a larger diameter opening at the top of the femur. Now, we need to create space for the nail throughout the rest of the femur. Reamers of increasing diameter are passed over the guide wire to enlarge the space inside the femoral canal. Based on our length measurements and based on the reaming of the femoral canal, we select a rod of the correct length and diameter. The rod is prepared for insertion over the guide wire. Using a mallet, we insert the rod down the femoral canal until it reaches the distal end of the bone. A calibrated targeting device is attached to the femoral rod to guide placement of further fixation into the bone. The aiming arm facilitates the insertion of a bolt into the femoral head for fixation near the hip. A guide pin is placed through the targeting device into the center of the femoral head. We use the C-arm to verify the positioning. Once the position of the pin is confirmed, the pin's length is measured so that we can implant the appropriate bolt size in a process similar to the rod itself. We then drill over the guide pin to prepare a path for the bolt. The bolt is inserted using a mallet and advanced until it is flush with the targeting arm. A set screw is tightened at the top of the rod with a screwdriver to lock the bolt in place. This prevents migration or loosening over time. The aiming arm and guide pin are removed, and an additional sterile drape is applied to expand the working field to place further screw fixation near the level of the knee. We drill through both cortices of the bone. We then use a calibrated depth gauge to measure the necessary screw length and insert the screw. This process is repeated for the second screw, providing secure distal fixation for the femoral rod. Final fluoroscopic images confirm that all implants are properly secured, the rod is aligned, and the fracture reduction is stable without complications. The incisions are irrigated with sterile saline to remove debris and reduce infection risk. Deep and superficial tissues are closed with absorbable sutures. Sterile bandages are then applied to protect the sites.